Hello everyone, it's a great day and a pleasure to have you join us today on the program Healthy Living. I'm Adisu Walsawagia. Today we want to look at alternative conception, why you should key into it, and when you should key into it, and of course what it means, because quite a number of persons are childless today because of one or two reasons, and many of these reasons can be treated. All right, so today we have a consultant, clinical embryologist in the house from the University of Benin, who's going to be talking to us today on what fertility vis-a-vis what you can do means today. So join me as I make welcome Dr. Kennedy Ibadin. Is a consultant clinical embryologist from the University of Benin Teaching Hospital. It's a pleasure to have you join us today.
Thank you, madam.
All right. So we're looking at fertility. We're looking at what can be done when you discover that you're infertile, and how does one know that he or she is infertile? Because most often the time, you see that when people have been trying for after marriage, they see that they cannot get, they leave it to fate without even trying anything out at all. So infertility, what does it mean? How does it happen? What does it entail? So there's plenty of questions at once, doctor.
All right, thank you. As a matter of fact, let me use this biblical language. It said, my people perish because of lack of wisdom and knowledge.
Knowledge. Mm.
Yeah. Infertility, to the ordinary layman on the street, is inability to have children after some years of marriage or cohabitation. Mm. Like maybe there is no fruit of the womb, which is really the essence in some society as the reason for marriage. So, but in the medical terms, if after 1 to 2 years of uninterrupted sexual exposure or cohabitation, there is nothing to show for it, infertility set in.
Okay.
That is when the couples will not be seeking for medical intervention to know what is happening. Mm. Yeah.
Okay, so seeking alternative means of conception, what would the person do? What should the person do? Where should the person go to?
Yeah, thank you for that question again. First and foremost, in short, the textbook definition of infertility, textbook, that is the scholar definition, is after 1 to 2 years of uninterrupted sexual exposure, if no child coming up, infertility setting. But now, because of the awareness, everybody wants to have children in the family. That definition is now old, because some people will not even wait up to 6 months before they now start seeking for the fruit of the womb. And depending on the time, the man or the woman got married.
Okay.
Now, first and foremost, if after 6 months or 2 years, nothing is coming up, then your next step is to visit the hospital or fertility clinic to meet fertility experts, who will now first and foremost examine you. For the woman, we'll look at some parameters. We'll look at some investigations. Then for the man, we also look at some other investigations. Like for the woman, we look at the tubes, which is the fallopian tube. Those days, the biology is called ovidot, the fallopian tube, because that is where the egg and sperm supposed to meet before coming to the womb to settle, stay for 8 to 9 months, and be delivered. If those tubes are blocked, if that is what's called blockage of those tubes, where the woman supposed to release a matured egg to meet the good quality sperm coming from, the man, pregnancy will not result. You must have to assess that one, assess the tube. Then looking at the womb of the woman, for instance, is there anything that is occupying the space where the baby is supposed to stay? Is it something like fibroid, any abnormalities? You look at it. The doctor will send them for scan, look at the scan report, then look at what we call some hormonal profile that control the quality and quantity of the eggs this woman is releasing. And this is also tied to age. Then all these three fundamentals, they are very, very important for the woman. But for the man, one of the first singular investigation to think of is seminal fluid analysis. Let us look at the semen profile. At this, is the man's semen okay? When we say okay, is it within the normal range?
Okay.
Based on WHO standard? Or is subabnormal? Or no single sperm cells at all? Or what is the problem? All these things must be investigated before we not classify the woman to say, okay, yes, you need this kind of treatment. Or you need this kind of advanced treatment. Or out of ignorance. They don't even know. For instance, the woman may be ovulating.
And she will not know.
She will not know. And that is when the husband will travel. And the husband will not come back when the ovulation must have gone. So counseling and whatever things are involved. So infertility is 1 to 2 years. This is what the textbook tells us. But now the modern definition is after 3 to 4 months or 6 months or even 9 months, some couples start running helter-skelter.
All right, let's look at causes of infertility in men now before we look at that of the woman, because you gave us quite a number of things to look at for the woman already. But a man, particularly a man who has had a child before, because we have seen instances where men who have had children before will not get married or maybe looking for more children and find out that they cannot have more children, and then the problem now falls on the woman as the cause of the problem. Now, why would a man who has had a child before suddenly become infertile? What could be the reason? At what point does that happen?
Yes, this one also gives us 2 types of definition of infertility: primary and secondary. To relate to the man, for instance, a man could be once fertile and later not fertile. In other words, the semen quality or the sperm quality of the man was once okay, but now no longer okay. So we look at so many factors or reasons that could be that is maybe responsible. The major factor is we have what we call in medical language symptomatic factors and asymptomatic factors. Everything has to do with let's look at the infection first, because it is very easy for some men to be blaming
the woman.
Infection. Infection may not really be the main reason. There could be other reasons why the man was why the man that was once fertile is no longer fertile, which will affect the quality and quantity of the sperm. Infection is number 1. There are some silent infection, not this one they are doing. These jingles they are giving us, Staph aureus, E. coli. A man that has, for instance, 120 million sperm cells, beating the WHO maybe record. If you have Staph or E. coli, little or no damages will be done to that total sperm count. The man will still be fertile. But we have some of them that we term severe oligospermia. That is very low sperm count. Any infection that enter there will remove the few sperms that are there. Before you know it, it moves to the other level. Do you understand what I'm saying? You see, we've also, every day, I agree with you, they keep on blaming the women. It's not like that. Going by my studies and going by what we are doing is, if possible, 60-40. 60 against the man, 40 now for the woman. But because of this ego in the society, the women are always blamed. So, infection is number one. Then hormonal insufficiency, these are medical things. Hormonal insufficiency means those things that control sperm production and transport.
Okay.
Some things are, the blockage of the sperm duct, in other words, sperm tube. Sperm is produced from one part of the organ, transported, and be stored somewhere where they are released. If there are blockages or there is a blockage, somebody that was once fertile could be infertile.
Okay, as an embryologist, what's the way forward for a couple who are looking for kids? What should they do? And how do they go about it? Because a lot of persons, like you said, a lot of persons suffer as a result of not seeking the right way and not looking for what to do. So what are the step-by-step things after investigation and all of that? What next?
Okay. Thank you for that. See, if all the results are now before the clinician, the man's result and the woman's result, after running all these tests. For the woman, we look at the result. Okay, fine. Number one, hormonal profile, fantastic. The tubes are not blocked. The woman are free. Do you understand what I'm saying now? Then for the man, the semen is fantastic. That is normospermic, means the sperm count is normal.
It's good, okay.
Now the question you have to be asking yourself, and the woman is within the best reproductive age, maybe between 20 and 30?
That's the best reproductive age,
no,
20, 30?
If I say the best, I'm just talking of this question you are giving me now.
Okay, before you continue, what is the best, so that I don't forget that, what is the best reproductive age for a woman?
From 18 to about, you see, from 18 to about 30, okay, then sub from 30 to 35,
okay,
then from 35 to 40. You sure, as a matter of fact, 18 to 35 is okay, but that doesn't mean a woman who is 38 or 40 will not also give birth, but there are reasons tied to that. You understand what I'm saying?
Okay,
so,
good.
If both result of this couple, they are okay, it is very easy for your pastor, for instance, let me not use pastor here now so that they won't be looking at me, to say, it's a spiritual problem. This is a home trouble.
Okay.
Do you understand what I'm saying? But it's never like that. And this is where your native doctor eat money. But to us, something is happening somewhere. This is what we call unexplained or idiopathic infertility. Unexplained means everything is normal about this couple, and yet no pregnancy. So in this case, we tend to initiate another advanced method of getting the woman pregnant, using the husband's sperm.
Okay.
What we call intrauterine insemination. Let me stop there first.
That's fantastic. So,
yeah, okay, now, yeah, let me go for that.
Yes.
But where, for instance, the woman is okay in all parameters, within the same reproductive age, and the man has what we call low sperm count or no sperm count. I repeat, no sperm count or low sperm count. Ordinarily at home, they cannot, such a man cannot get a woman pregnant because of the kind of sperm or semen quality. So to avoid what we call the woman that is aging gradually to directly or indirectly affect her reproductive system, we will say, okay, let's come for IVF. Okay. Even when the woman tubes are open. Even when the woman tubes are open, that you would have done what we call IUI, I've just told you. But we would not say, okay, come to IVF.
Come to IVF. In
IVF now, no matter how small, how little, the quantity or quality of the man's sperm, no matter how few they are, in vitro fertilization, or what we call assisted reproduction technology or techniques, we can get the woman's egg fertilized with those few sperms and transfer into her system or the uterus.
Is it possible for the uterus of the woman to reject such a process?
Yes, it's possible. You know, when you start looking at all the techniques that are involved in IVF failure among some women. As a matter of fact, IVF means fertilization of the woman's egg and the man's sperm outside the body, transferred to the woman's womb after about 2 to 3 to 5 days. And after transfer, what happens? We tell them to go and relax and take other support drugs for the next 14 days. And despite the quality of the embryo transferred, they will still get a negative result. Because
that's quite disheartening.
Yes, implantation. You see, implantation is one of the basic and fundamental failure in IVF. We've done what we're supposed to do. The knowledge God gave to us, we've done it. So we've applied it. We've given the woman good quality embryo. Let me use children for the audience to understand. Then after 14 days, those things are not seen there. They are rejected or accepted. What
could be responsible? Because I've thought about that. I know somebody who did IVF like 7 times, and she said, no, she's not doing anymore. She never succeeded in all of those 7. So, like, I'm wondering, what could be responsible? Is it the woman's body? Is it something about the woman that's rejecting all of this?
It affects both the man and the woman. First and foremost, let us look at the quality of the eggs that is coming from the woman and at what age that we are getting that egg. Okay. For instance, a woman who is 38, 39, or 40 or 41, we are collecting eggs from her after stimulation. We should expect few quality eggs
from such a woman.
For such a woman because of age factor. In comparison to a woman who is 20 to 25, for instance, if we get 10 eggs from a woman who is 38 to 40 years, and the same 10 eggs from a woman who is married between the age of 20 to 30 years, you will discover that 6 or 7 out of that woman with 20 to 30 years, the eggs will be good.
Very good.
But that woman, maybe 1 or 2 or 3, for some reasons, molecular reasons, some deep, some other reasons, okay?
Unexplained reasons.
No, they are not unexplained. Okay. In Africa, let me use Africa. We are limited by some factors.
Okay.
You understand?
Because of our race.
Yes, like in Europe or US, America, they do what we call single embryo transfer. Single embryo transfer means if you like, you have 20 good quality embryo, they will transfer one. For some reasons best known to them. But they will make sure before they transfer that one, they must have done all the studies about that embryo and find out that it's a good one that will likely to implant. But here in Africa, everybody wants quadruplet, heptaplet, octaplet, twins, name them. Do you understand what I'm saying?
I do.
Yes. So these are some of the factors that work against them. But we still see some women who are 44, they are still giving birth. But mind you, at least they must have had 1, 2, 3 before that 44. But the woman that just coming in 44 had surgeries to remove fibroid, had surgeries to remove abnormalities. Then the husband with a poor quality sperm, and you are coming to do IVF, he take the grace of God to intervene. That is where assisted reproduction technology set in, where we have to go further to look for an assistance.
Meaning?
Yes, such a woman that be having repeated IVF failure.
No viable eggs, so to speak.
Repeated IVF failure. There is an advice for such woman, surrogacy.
Is surrogacy lawful in Nigeria?
As a matter of fact, you are talking of lawful. It's not yet lawful, but we are doing it perfectly well. Even some people in high places who are saying it's not lawful, they are also beneficiary of that program.
I was reading somewhere on the net where it said that the more eggs are harvested from young girls, the more susceptible they are to cancer. Is it true?
That is if you read something about Panadol, they will tell you Panadol, every drug has its own side effect. But it's advisable for young girls not to do it at least more than once or twice a year. But now that they see where they're harvesting money, they don't want to stop. Do you understand what I'm saying now?
But is it possible that such a young girl can come down with cancer?
Out of 100, you may see 1 or 2 like that, but not just. It's just like a man who deposits sperm here and there, anyhow.
Everywhere.
I think the cancer of the prostate. It's not. But there is a tendency.
Okay.
But out of 100, very few.
Okay. So as an embryologist, now before we leave, what's your advice to couples who are who are looking for kids? Rather than going to church, rather than thinking it's spiritual, rather than thinking one mama or papa is somewhere doing them, what's your advice?
Yes, my advice for such couple is this. You see, the truth is bitter. You will keep on saying it. One of the factors responsible for promotion of infertility, I don't want to mention this aspect so that I don't trigger off some reactions. My advice is that they should come forward for early enough from your reproductive age, 18, 20, for some of these fundamental investigations. Do you understand what I'm saying now?
Yeah, I do.
But unfortunately, some of them will go to this house for prayer, fasting, native doctor here and there. But you see, when I saw
all sort of concussions.
Thank you, to damage their womb, damage their sperm, damage their ovaries and everything before they finally rush to the hospital. As a matter of fact, let me say this one clear, loud and clear. I told the nurse where I'm working with in UBTH, when I saw 2 women with these characteristics of particular hairstyle between the age of 45 to 48, I told my nurse, I said, before these women finally enter this unit, the prayer warehouse in heaven must have been exhausted. How can we not be managing such a case? You know, pregnancy should be difficult at that age.
At that age.
They will require an egg donor, an assistant. Let me use as an assistant. And so forth as well. Okay. So my final advice is, please, whether we like it or not, the greatest profession, where other profession comes from, is this profession that deals with giving couples, making them happy offspring.
Thank you so much, Dr. Kennedy Badin, for time spent with us. We hope to do this again. Yeah,
they said it's 1 hour. That is why.
No, we're done now. All right, we'll see you again next week, and hopefully Dr. Badin will be here to discuss further on this issue, because it has eaten deep into the fabric of so many marriages.
I agree
Thank you for watching. Bye-bye.
Thank you so much. God bless you.